Hi, welcome back to my podcast. My name's Sarah, and today we're going to discuss different nursing organizations or associations that affect healthcare policy. So I'll start by saying I myself have not been involved in a nurse association previously. The only one I've looked into is the ENA, the Emergency Nurse Association. I was looking into this when I was considering taking the Certified Emergency Nurse exam. ENA offers a lot of continuing ed resources in general and specifically to prepare you for the Certified Emergency Nurse exam. Didn't end up joining because I didn't end up taking that exam. I left emergency nursing for a while, but that was one that I looked very seriously into, and I thought it was a great option for emergency nurses. But there's several different organizations and associations that you can get involved in as a nurse. I think one of the most prominent one is the American Nurses Association. So that is a national association. Any nurse can join. They can work closely with Congress, with Medicare, with Medicaid, to advocate for different healthcare policies. On their website, you'll find one of their priorities is safe staffing ratios. So they're advocating for nurses here. Yes, the policy changes will impact patients, will create better patient care, but they're advocating for nurses, which I think is great. They're talking about safe staffing ratios. They're talking about a healthy work environment. This became more of a priority after COVID, so mental health. They want to make sure their nurses are safe, also safe when they're dealing with public health responses. So that's a great organization. You can find a lot of information on their website. I'll link below. Definitely look into it. They can work with the nurse practitioners on their scope of practice, but I think another one that is great when addressing the nurse practitioner scope of practice is the American Association of Nurse Practitioners, as well as Missouri Nurse Association. So it's state dependent, right? The nurse practitioner scope of practice changes state by state, in small ways most often, but you have these two associations that you can join, that you can find resources on, addressing how you can advocate to expand your scope, to practice within your scope, resources on continuing education. There's some challenges when it comes to framing agenda because the nursing field is so broad. So you have all these nurses joining these organizations, associations with different priorities in mind, different goals that they want to achieve. And I think blended strategy helps you take advantage of the multiple advocacy tactics to kind of take on that challenge of the broad scope. So blended strategy means when you're taking advantage of these different tactics, you're taking advantage of the different levels the organizations practice at. You're being involved in community, you're being involved in conferences, you can be involved in associations at a national level and state level. You can go to a town hall, even writing legislators. So there's lots of different levels that you can be involved in. You can advocate for others to be involved in. That's a way to use blended strategy to take on all of these policy changes that we want to advocate for. So I will link these organizations that I've mentioned below. Their websites have a lot of resources on how you can join. You don't have to join to use their resources. Some of them just list great articles and great continuing ed opportunities. So yeah, I'd highly encourage you to check them out, even if not to join, just to learn a little bit more about what's going on in the nursing world around you. I hope this was helpful. Thank you for your time.